Hello everyone. Welcome to another VITA Learning webinar. Today we have Mr. Peter Peasy going to go over some exciting information, talk about color matching, how to produce depth, color, how to work with contrasting porcelains, and so forth. How are you doing, Peter?
Good. How you doing, Jim? Good to talk to you.
Good. Excellent. So we will start in a moment. I want to go over a few items with you, some housekeeping things with everyone. Just so that you know, your phone is on mute. And during the meeting, you can type in a question and send it to us. And then at the end of the program, we'll do a Q&A. So on that pop-out box from your GoToWebinar program, go ahead and highlight that questions box, type in your question, send it, and then we'll take those at the end of the program itself. This webinar will be recorded. We will then post in a few days on our VITA North America YouTube channel. There'll also be some links from Facebook, LinkedIn, Instagram as well. You will find, if you get to the YouTube North America YouTube channel, you'll find that there's a variety of Peter's webinars that he's done in the past. They're all about an hour long or less. So go ahead and look at those, review those. And then, of course, down the road later this quarter, we will also have additional programs with Peter on different subject matters. So again, the webinar will be recorded and it will be posted on our VITA Learning website, YouTube channel for VITA North America. And then at the end of the program, you will also receive a notification from our education marketing side regarding CE credits. So if you want your CE at the end of the program, you should receive an email from our company, and it'll just ask you the information like what is your CDT number and so forth like that, just to be sure that we have that information on hand. So Peter Peasy, he owns his own dental lab. It's Peasy Dental Studio in Staten Island, New York. He's been a technician since 1984. He has a CDT and an MDT. He has a personal appreciation and expertise on all phases of traditional and digital dental technology and photography. In the past, Peter has been gracious enough to also do photography courses with us, and also about shade, color, how to take accurate shade, how to then control it while you build up. Also digital. Peter's doing, and Peter, you can add on to this as well, but Peter's been also doing a lot of CAD CAM for the last couple of years. So it's been a whole new avenue, I think, for all of us to learn and to grasp and to carry forward in our technology for the dental. Peter's also been a member of the American Academy of Aesthetic Dentistry. He's a graduate, recognized specialist, and mentor of the Coyce Center for Dental Excellence, and the co-editor-in-chief of Insight Dental Technology.
You have to change that bio, Jim. I've been the editor for 2 years now. It's an old bio.
Oh, it is?
Yeah.
Oh, I'm sorry. You're no longer you are the editor.
I am the editor for the last 2 or 3 years now, I think it is.
Wow. I thought I had that reversed. I'm sorry about that, Peter.
No, it's fine. Believe me, I'm just joking. It's not important.
Yeah, no. It's good to know. So, and for everyone else, Peter's a wealth of knowledge, has a lot of influence in our dental market. He works with dentists very closely. So a lot of his information that he provides us, the education that Peter provides us, is not only from the standpoint of a technician with your hands, but also the lens through what the dentist sees, and which is really nice for all of us, because many of us never see the patient live with the end result, which is too bad, but that's the way our industry is a lot of times, right, Peter?
Yeah, unfortunately.
So I am going to turn this over to you, Peter. And so I will make you the presenter, and we will see everyone on the flip side of Peter's presentation.
No problem.
So Peter, you should have it now.
If you have any issues, let me know. I know last time something disrupted us, so just shoot me a text or anything if anything goes wrong. But in the meantime, we'll get rolling.
You got it.
Thanks, Jim. I appreciate everything. Thank you, and thank you for our title today. So I'm crediting Jim with this one, both for the good and bad. So mixed bag case. I think the point of it was a great point, right? Because we do so many different cases today. How do we manage all the processes of it? And I know this one was probably a little more challenging for me to put through in the sense of what I wanted to talk about and how to utilize that. Look, in the end, I think that the truth of everything we do comes down to this, the aesthetic world that we live in, and trying to make things work and look real and harmonize in nature. So in the end, it's really all about the aesthetic parameters that we work through. And our job is to utilize our knowledge to make things work. So something as simple as this, that might seem simple, isn't always as simple as it seems, right? Being able to match one tooth in the mix of other teeth and have them blend not only from a value and harmony point of view, but with the tissue and the light reflection and all the little details, right? Because what makes this work, and by the way, that was a no prep veneer, what makes this work, my buddy Dr. Dane did this, which he did a great job on his end with the communication and all the workflow. But what makes this really work is all the little detail-y things, right? Look at the optics of nature on the central. It's a little bit of a lower value luster to it. You can see where the light reflects. You can see some of the surface texture. I would argue if I did anything wrong, maybe I could have a little bit lower of a luster or surface to it, although it might just be the angle, because this one has a little bit more of a sheen to it. So it kind of depends on the angle of the tooth. But also the light reflection. Look where the light reflects on the line angle and how I absorb, and the tissue harmonizes nicely, and all those little details. So it's all those things that go into us making things work. To make it even more complicated though today, we work in different spaces. And I think this is really where Jim came up with the mixed bag concept. And it's a great one, right? Because I don't think there's a case I do today that isn't really just straight same amount of units or the same depth and space on all of them. It's almost impossible, especially with implants today. But it was always kind of that way. It just really got more and more evolved over the years. So an example, this is a case from a lot of years ago, but I remember the challenges where I was a young patient. You didn't want to do a lot of prepping, so the doctor prepped a minimal veneer, which back then was really minimal, 0.6 of a millimeter, and a full coverage restoration, which, by the way, only had 0.8 of a millimeter on. And if you look at those two options and you say to yourself, well, those are tough challenges, especially if I wanted to use a substructure, because that's going to take up 2/3 of a millimeter. So in the end, what am I really doing is trying to figure out how to manage those two spaces. And that's what we did, whether it was 10 years ago or today. I think the difference is, and this one was 10 years ago, if not maybe a few years left, but something like that. But the point of it is that how we manage that space has become critical for us. And I think the more we evolve, the more common this has become, because for me, this is almost normal today, right? That case, this older case I showed you, God, I remember that struggle thinking, how am I going to make this work in such a small amount of space? And with the substructure, we had a zirconia coping underneath there, and it worked. But today it's almost the norm. Most of my cases that I'm working through are all those kind of tricky cases where I'm dealing with space, how to manage it, how to utilize the materials, how to understand the optics, the position of the tooth. So I want to break this down for you a little bit. And I think some of the keys here when we're talking about optics are a few things. One, tooth position plays a huge role in what we see. Where the teeth are, their angulations, which one's out before, in front of the other or behind, or how the angulations of the teeth affect what we see and how we understand it. The space that we work in, but we have a minimal amount of space or a lot of space to work in, or what we're working on. What I mean by that is, are we working on a prep shade that's A5, or are we working on a beautiful, A1, 1M1 kind of prep shade that we could utilize that color for? So you have to put both of those together, space and the surface that we're working on. And also part of that surface is the material, because there's different optical properties between zirconia, lithium disilicate, and metal ceramics, if you're still using it, which I am, by the way. And then that brings us into the material options. Which materials work? Which ones work well in the space provided? And how do we understand how to utilize that material? And then the last part of the optics is the gingival harmony. You can't really create optics of your restorative without it harmonizing with the gingival aspects of it. So that aspect of it becomes really important that we work through that. So let's start with position. Position is kind of challenging because what we don't really always realize is, as we look at teeth, what we see and how we see them become more challenging based on the tooth position. So in this particular case, with the picture you're looking at on the left of your screen, you're going to notice the tooth that really pops out the most for you is that number 8. And that number 8 tooth really pops out because of a few different reasons. One of those reasons is not that it's really so much more forward than the other teeth. It is a little bit more. It looks like the distal pops out a little bit more. But it's really more about the color, because in truth, if you look at the adjacent space, you should notice that the spacing on the 8 compared to the 9 is actually less. There's actually a little bit of less space on the number 8. But yet that tooth is the dominant pop-out tooth. So that has to do with the value of the tooth, the brightness, and the position of the tooth. So we have to take that into account all the time when we're working through our restorative. How could I fix that? Well, obviously I can get the value to the number 9 to be similar, or I could bring the distal of the number 9 out a little bit more to make it look a little bit more like it's a similar light reflectance. You'll notice here, if you look at the light reflectance, obviously this is just a bad crown or a provisional, but notice how the light reflects off of this number 8. And if you look here, it's kind of a different reflection. It's because this whole distal fades away and fades behind. So even though this is actually a much wider space, it appears to be a weaker tooth because of the coloration and the angulation of it. The next part of it is the space and the surface that we deal with. So I think this photo should also be a little obvious to you in the sense that the prep shade on a tooth like this is probably going to be a fairly good prep shade, where on this tooth, I could see underneath this restoration that's already really dark under there. So that's going to change the game for us a little bit. And if you really start to look at the actual teeth, you can see what I mean. One, I'm going to deal with a lot of space on the 7 and 9 position, and very minimal space on the 8 and 10 position. And that's going to have to change how I think through the process of what I'm doing, especially as I'm trying to make optically my material work the same. I can tell you that I'm going to treat this case with 2 materials, and I'm going to kind of classify them as 2. I'm going to use zirconia as my substructure, and I'm going to use feldspathic material on top of that and on my veneers. So why am I saying 2 materials? I have a substructure, that's my zirconia, and then I have a feldspathic ceramic. And my goal with this case is really going to be to manage the ceramic to be similar across the 4 teeth, and utilizing my zirconia to take up some of this space optically that I wanted to do. And that's going to be the challenge with all these cases today, is how do I manage that material? And I'll kind of break that down for you a little bit as we go through today, and which material, because they didn't have to be zirconia, by the way. I could have treated this with metal ceramic. I probably could have treated it with lithium silicate or disilicate. All of them would have worked fine, honestly. I don't think one of them would be better than the other in this particular case. Let me go back to that picture if it's important that you see that. Why? Why could I use all those materials? Well, one, whether this was metal ceramic, zirconia, or lithium disilicate, I have the same challenges. I have a lot of space to fill, and I have to be able to get my value up. And I could do that just about with any material. I might even argue probably a better strength would be with zirconia or metal. Lithium silicate and disilicate does tend to have that lower value nature to it. So it really have to make me rethink my ingot or block selection to get that value up to where I need it to be to start. Doesn't mean it can't be done. It just means it's a little more challenging sometimes. I guess some of you can argue, but wait a second, if you did metal, you're working with metal, and that's going to make it more difficult. And I would say, yeah, I could, but the difference is my metal coping would be 0.2 of a millimeter. I could opaque it any color I want, and it leaves me a lot of space to utilize different opacious dentins and highly opacified or fluorescent materials. So it changes the game that way too. They all could work. Let me be clear with that. It's just a matter of what you think works best for that particular environment. And then lastly, the gingival harmony, making sure that whatever we put in harmonizes with the rest of the case, not only from an optical point of view, value and chroma, but also from the gingival harmony and how the tissue sits on top of the crown and fills in your interdental spaces, always really critical. So I won't walk you through too many details of this case, except just to tell you that we originally planned this as a 6 or an 8 unit case. We changed our mind midway through because functionally, this patient actually had their main function on their cusp tips, and if we were to touch those or remove them, we would change the whole occlusal nature of who he was. So we decided to just treat the 4 units and 1 unit on the lower arch, which you can see the discolored tooth here on the number 26 position. And we did that, and the restorative worked out fine. We also did manage the gingival architecture, right? So I mentioned that the gingival component is a big part of that for us. I had 2 altering heights, and that's going to determine the aesthetic challenges that we were just talking about, right? If I have 1 tooth that's 12 millimeters long and 1 that's only 8 millimeters long, usually the longer one's going to look brighter and larger, depending on its color. But normally, if they're both the same color, that's the one that's going to look brighter. So we want those gingival architectures to be very similar. So we did some crown lengthening, we provisionalized, and then final prep the teeth. Obviously, all the normal shade taking and determinations of color were done that we would normally do. And to be clear, because we were doing upper and 1 single unit on the lower, we went through 2 sections of photographs here. So I wanted to make sure that I'm matching the lower tooth, not making the same tooth that I made on the upper. And I can tell you that I actually used a completely different formula building up that single lower tooth in the end. Patient was provisionalized, and so the tissue starts to heal back and come back around, and I made my final restorations. And again, I'm working with a zirconia coping, a feldspathic veneer, a zirconia coping, and a feldspathic veneer. And my goal is to get the optics of these to look the same across the arch, and then also 1 single unit on the number 26, and make sure that harmonizes with the 23 contralateral. So again, notice what I'm trying to match here. I'm trying to match my restoration to the contralateral tooth. I'm not trying to match my restoration to the adjacent tooth because it's lateral to lateral, central to central, cuspid to cuspid. So I'm thinking different, or you need to think different a lot of times when you're looking at what to match. I know from a photography point of view, when the doctors communicate shade, a lot of times the doctors will put their shade tab on the adjacent tooth. Well, that really only works well if the adjacent tooth is another central. Otherwise, it's not really the right way to go. I always want to see contralaterally what the shade should be. So our final case, you can see how that kind of worked out. I think in the end, it did what we needed to do to make everything work. But you see the challenges there, right, of managing that space in those areas and the different positions of what we have with our patients. And this is kind of common today. I think almost every case I do these days, I feel like I'm dealing with either too much space or too little space. There's nothing kind of right in the middle. Even in a case like this, where we did a nice diagnostic wax up, matrices to transfer that wax up to the patient's mouth. We tried that in, we liked the shape and everything that we saw there. Now the challenge becomes is how do we manage that? Well, of course, we want to stay minimally invasive. So you can see the doctor's doing an ABT technique where they're prepping through the provisional, and they're going to try to keep this as minimal invasive as possible. And that sounds really great, except for the fact that I have to fill that space, right? And the space that's missing, which is a pontic area. In this case, we did a little cantilever off of the cuspid because he couldn't have an implant at this moment. And you'll notice that really what my goal is try to make my zirconia and my substructure have a similar optic ability to the adjacent tooth. And if I can get my zirconia, and again, this could have been metal ceramic, it wouldn't have done lithium silica or D-silica here, and not with a cantilever, definitely not. But I could have done either one of them. And by the way, I would have opted for metal ceramic if I felt like my connector size wasn't large enough for me to get the distance I needed. I would have had no problem going with the metal ceramic coping and the ceramic margin there. But in this case, we had enough length to support the zirconia strength. So we did that. And then after that, it becomes kind of that challenge of getting optically what I want light to do in nature and what I want light to do on my restorative option. I'm trying to balance the both of those so I get a similar transition between the two. so you don't really notice the difference. So realistically, I spent the beginning of that case using fluorescent materials and more either value or chroma type materials, so I can get this veneer to have a similar optic, or I should say it the opposite way. So I can get my zirconia to have a similar optic to what the natural tooth is doing or what that veneer is going to do for me. And that was really the whole goal there. Once I have it, then the rest is kind of easy, right? And it's really just a simple veneer case in essence. And I manage those the same way I managed all my other cases, right? Chroma, value, some enamel materials, translucency, picking up colors and brightness where I want to, and then finishing everything off with the enamel's shape and form, and placing that in the patient's mouth. And in the end, you'll notice exactly what we talk about: veneer, 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 full coverage, all zirconia, micro layered. And in the end, I hope if you notice from both sides on the cast, the veneer next to the veneer as compared to the veneer next to the full coverage zirconia. And you should notice that they have a very similar optic to them. And in the mouth, they have a very similar optic to them, even though we're dealing with a little bit less on the gingiva. Obviously, he's got nice tissue here, and we don't really have any tissue here. But in the end, optically, they kind of work in the same ballpark. And that's what we're looking for them to do, is make those work across the board. So that's space in essence. But space isn't really just about pontic. Sometimes it's about managing the tooth itself. And what I mean by that is when I'm looking at teeth in a case like this, I've showed this case before, it's a great case. Patient was in an accident, fell off his moped, smashed his face on the floor, broke some teeth. And I think the old school thought on a case like this would be really about trying to figure out how to root canal, prep, post-core, or do all the little old school dentistry that we used to do. We don't do that today. Today is the opposite. He's already done the root canal himself, so we don't need to do much more. We don't need to take away more tooth structure. We want to save the tooth structure we have. And as we do that, we have to understand material-wise how we work through that tooth structure. So in this case, I'm dealing with not adjacent teeth. I'm really dealing with the same teeth, but one of them has more space than the other. And this area here is a hard area for us to deal with and a hard area for us to manage. And those areas become really difficult because they become areas where optically, can I make my ceramic material operate or reflect similar to what the nature is doing, to what nature is actually done when it receives the wavelength of light. And I have to be able to kind of fool the light wave to do that. And to do that, I'm going to use different materials. So this case was a case I did a few years ago. I actually used my Effect Chroma 1, which is a very white, more opacious powder in the VM9 kit, and I mixed it with a little bit of an internal 1. Now, the internal 1, for those of you who don't know, is highly fluorescent, and at the time, that was probably the most fluorescent material I had. I still use it today, here and there when I need it, sometimes even on zirconia when I'm trying to brighten something up or get a little more fluorescence out of it if I'm not using an effect liner or a margin material. But in this particular case, I needed it. And the reason I needed it was because I had to get the optics of light to change from this point of the tooth to the air, to the area where there was nothing there. And to do that, I know at the end, I was going to be very thin. So if you look at this from the incisal edge position, you see how thin this is? There is really no material that can be that thin. None of them that are made from any of the companies today that can be that thin and still optically reflect or absorb light the way we want it to without us incorporating something else to it. And the something else to it in this case was the highly fluorescent internal number 1, which is, again, the most fluorescent material that I think I have in most of my kits. That's a stain technically, but I'm mixing that stain in because I needed that little bit of extra fluorescence there. And again, once I have that, then the case becomes a little simpler to manage. I could treat it with one dentin. In this case, I used transition dentins because I was mostly veneers. And then after that, my enamels. And the goal was really the same, to try to make it optically where when the light hits this area, it does the same thing as when it hits this area. And that's always really the challenge for us, is either where the tooth ends or where the substructure ends for us. It's kind of the same challenge all the time. And it's my job and your job to manage that area, either with substructure, materials, or kind of using Jim's term, mix bagging it and learning how to mix in some other materials like a fluorescent stain or something that has a little bit more to it that allows me to manage it. The way you think of those things, for those of you who don't do that often, is really by creating a better understanding of the materials themselves. And I think this is one of the things that I find when I teach courses. I did a little hands-on course in New Orleans a few weeks ago, and you know, it's funny to me when I ask ceramists what their take is on the opacity of their dentins and opacious dentins. It's something that is almost not known, and it kind of surprises me because I sarcastically and jokingly say, "Are you sure you're a ceramist?" I'm not sure how we've gotten this far and not understand that most of the materials we use are much more translucent than we realize. And our job is to understand, do we want that translucency or do we actually need some more opacity? And sometimes we can't get what we need out of opacity based on space. And that's where the use of fluorescent materials and other materials really come in for me that I tend to use a lot. So what you're looking at in this photograph is a normal dentin at 0.8 or a millimeter thickness, an opacious dentin at 2 to 3/10 of a millimeter, and then an opacious dentin that I actually mix some fluorescent stain into, and still at 2/10 of a millimeter, but now has the ability to do a little bit more masking because of how it manipulates the light. But these are the materials you kind of work with all the time. And that's why you really have to have a better understanding of what you can use and where you can use it when you're fighting through the processes. So if you take a look at these two units based on putting that little underlying heavy chroma and a little bit of fluorescence in there, look at them optically in light. You can see that actually I'm getting a very similar light optics on both of them, even though one prep ends up here and one prep ends way down here. And that's really the goal, right? Is intraorally to make that work where you can't really tell the difference, that they all look the same. This case, I think about 5 years old now at this point, and I'm knocking on wood that they're still in his mouth. And yes, I didn't have a problem extending the 3-4 millimeters of tooth structure. He didn't break it through function, he broke it through an accident. So I showed this in London a few years back, and I think this is a really great example for how we do this. It was actually a course, a 3-day course that we did. And I think it's a great way to really examine it, because when you're dealing with different spaces and different issues, you have to think differently. So I had designed this program for this particular course where we did a 4-unit bridge with white and pink, and part of the plan was, sorry about that, part of the plan was to have a micro-layered veneer, meaning that I'm going to be almost full contour zirconia on the laterals. So you notice the whole lingual is zirconia. Facially, I have very little space, and I'm going to do more of a micro layer on these. And then on the two centrals, I'm going to do a fully layered restoration. So I'm going to be able to use as much powder as I want. I'm going to have 1.5 millimeters of space. And the goal is to make those two teeth look the same at the end, even though one is going to be 6/7 of a millimeter and one is going to be 1.5 millimeters. And it's my job to make them look the same. And to do that, I have to, so here's a better example of that. So you can see how little space I have on the laterals and how much space I have to work with on the centrals. So obviously the design of my substructure, and I've covered this before, is very critical, where I'm looking to have light reflection and absorption. But let's be realistic. If this was, sorry about that, I shouldn't have brought the phone in the room with me. For me, I could turn the volume down. So for me, I'm trying to manage some of that through the reflecting of the substructure. And again, wouldn't matter what substructure material it is, but I have to be honest and say, what if this is an implant and this is a natural tooth? Well, then it gets reversed, right? Because I don't have the same spacing, and it's not just a matter of saying that, oh, I can layer a little bit more or a little less here. I don't have the same space to work with, and I have to optically think about how to manage that better. So for me, this always starts with either some sort of fluorescence, and the fluorescence is either going to be in my liner materials or my margin materials or in a stain material. Those are really the 3 areas where you're going to get the most amount of fluorescence from with most of the materials that we use today. In this particular case, I treated it with liner material, but I would argue that even with my liner materials or margin materials, sometimes they're not enough. And the reason I put the little accent stain tab here is because I actually wound up using all 3 liners here. I used an effect liner 1, an effect liner 2, and effect liner 3. For those of you who don't know what those are, the effect liner 1 is very white and bright. 2 is a little warmer, it has maybe a little bit of an A1-ish, A2 to it, and A3 is kind of A3-ish range. The 3 is in that A3-ish range, right? So it's kind of similar to that scale. But here's the problem. If I wanted A3-ish color, and I utilize it here, it sounds like it's probably going to be fine because remember I have 1.5 millimeters of space to work in. But I don't have that here. Here I had 0.6 of a millimeter or 0.5 of a millimeter. So if I use the same A3 or EL3 liner, which is really what it's called, am I going to get the same color there? And the answer is no, because when I have space to provide thickness, which gives me more chroma, when I have less space to provide thickness. So how do I change that? Well, I could go to a more chromatic liner, which is one way, or I could just increase the chroma in the liner that I'm using. And that's what I actually did. I took a little bit of the A accent stain and I mixed in a little dot of it. After I built these 2 up, I had the same material on my tray. I mixed in a dot of the A chroma and I used that on my 2 laterals. This way I'm increasing the amount of chroma on the laterals to have a lot less space to work in. And I could just kind of trick that by using some of the accent stain to do that. And to me, that's kind of a nicer way to do it than having to take out 3 more powders and try to get to where I need to, throw a dot of stain in after the first build and work through it. The other liners that I used was the 1 and 2. The 1 was the brighter whiter, and I used that more in the centers of all 3 of the teeth, to be honest with you. And then the 2, I actually mixed in a little bit of the bluish accent stain to it. And the reason I did that was because I have the ability to create translucencies here. I don't have it on the zirconia background. So I wanted to get a little bit of a bluish kind of a halo going on in here so I can actually have some of the similar effect that I'm going to create in the other restoration. So that would kind of be my whole setup. And you get a closer look at that so you can really start to see. I've created a little bit of that bluish. I have a little bit more of a brightness here, and I got much more chroma in this area. Where here I have a uniform chroma, but not as dark as this. I have a little bit more of the brightness, and I'm not worried about the translucency because I'll control the translucency with my translucent materials. And then again, it becomes a simple build-up, right? My dentins, my mamelon materials, my enamels. This was a 3-day course, and like most of my courses, we barely finished the case. So I'd say that after 1 bake and 3 days of talking, we were close. It still had maybe a little more chroma it might have needed, but it was fine. I think the example of it was we were able to give it something similar to what we were trying to match in the patient's mouth. It wasn't a real case, it was just an example. Before we go too much further with this, I want to be clear that none of these things work without your understanding of the 3 basics, right? And those basics are understanding the photography concepts. I'm not going to go into that today, just really for time. 2, understanding tooth form. And you can't do enough to really, I know I've been working so much harder on my forms lately, and it's kind of nice to kind of revisit and look at some of the things that you kind of forget or don't apply enough. Tooth form is key. And then the third aspect of that, or the third part of the triangle, is your understanding of not only the material substructures, but how to use your materials across the board. So photography is king. And again, I'm not going to spend time on it, but it does help us with color analysis. When I'm talking about color analysis, I want to break it up into 3 sections: the gingival, the middle third, and the incisal. I always want to kind of have that same process. No shade tab, not even the 3D linear guide, which I'm a big fan of, is perfect to nature. They're all really representatives. Personally, I'm a fan of the linear 3D. I think that's the best system we have. But I get it. If you're still using the classic guide and the A1s and B1s, remember there's none of them that match teeth. To the doctors who are listening, I always have my pet peeve of saying if you're telling your technicians to match the shade guide perfectly, then you don't really understand color, because it does not exist that way. That is not an A1 guide or even a 3D guide. Nothing would match a tooth perfectly. They're just shade references for us to use to create the value. And I always kind of tell people that when we think about dental color, there's a whole world of color out there, but the color we work in is just this little tiny space in here. And if you really get to analyze that space, you'll notice that realistically the colors that fit in there are kind of the A1s, A2s, A3s, B2s, B3s, and that's about it. Notice I didn't say B1, #1 remade shade throughout the United States and probably the world these days. Why? Because it doesn't really fit into the color spectrum of what nature is. And then the other reason for that is it doesn't really give us the value that we think it does. So it's a color that I probably never use in general. Once I want to get brighter and whiter, I fall into the 1M categories and the OM categories to push my brightness up. But the B1, even when doctors ask for it, a lot of times they say B1, I think, I'm not taking B1 out. It's not the color for me for nature across the board. How we use the photography is very critical for us. So again, I don't want to spend any time with this today because we've covered this before in other lectures, but the bottom line is if you're working in aesthetics, you want to make sure you have the right lighting. And if you're working more surgically, you want to make sure your lights are a little close together. But anytime you're in aesthetics, the lights need to be towards the outside. And when you're shooting your photography, the shade tab position is really critical for you. So I don't want shade tabs in empty spaces, on top of the teeth, next to teeth, always inside the ledge to inside the ledge position. The form part, you can't do enough to get form in your brain. I think even today at this stage of life, I go back and look at my forms and I'm thinking, boy, I got so much to learn form-wise. There's so much to think about and to really try to get an understanding of each tooth, each form, and there's so many versions of it. So I spend a lot more time with that these days, working on my form more than anything else. And a great little trick I'll just tell you guys is you can actually cut some teeth out of your cast when you see nice teeth you like and utilize them to play with, change angles and understand what it looks like if you drop the distals down and how it changes the embrasure spaces or the emergence profiles, or if I bring the distals out or if I overlap. And these little tricks kind of help you really work through the form. Also, utilizing your best friend, your red pencil, is very key. I always tell everybody don't cheat, meaning don't draw lines on your tooth, let the height of the pencil draw the lines for you. And that's really where you get to see the height of contour. And then I think the most important for you to understand is when you're looking at your teeth is what we call the optical volume and the real volume of the tooth. And again, it doesn't matter if you're dealing with 0.6 of a millimeter space or 5 millimeters of space. Whichever one you have, you still want to create the optical and real volumes the same. Let me explain those a little bit more to you. The way we look at this is optical volume is really what the light hits on, and it's the area that reflects the most of the light back from the tooth. And that's usually line angle to line angle. Now, obviously, I can make these line angles a little thinner or a little wider, depending on what I'm trying to look like. But the real volume of the tooth is really about the space that actual tooth takes up. And that's why that's much more difficult to manage, because I want my light reflection in this areas, but I still have to fill the space the proper way. So form is king. You can't work enough on that. And then the last part of this is the materials. Again, which materials work? Well, somebody made 2 poor crowns here, right? And it's easy to beat them up and say, oh God, they look so bad. Why do they look bad? Did the doctor not provide enough space? Did they not ask for the right shade? Or the technician not utilize the materials well? Did they layer 1 dentin and 1 enamel, or did they use 30 of them, but yet they all kind of mixed together and became one anyway? But I'm never impressed when people tell me I use 30 powders. That's not really an impressive nature to me. It's how you use them that matters, where you use them, and where they work from an optical point of view. So I can tell you that the flow with this case wasn't in the restorative space. I told you we always need 1.2 to 1.5. That's when we're dealing with full coverage. Obviously, a lot less in veneer world, sometimes 0.2 to 0.5. But if you cut this tooth off, you'll notice that as I measure it, it was actually about 1.5 millimeters of space. So realistically, what was the problem? The problem wasn't the fact that the metal was too thick. Yes, that was part of the issue. It could have been thinned out and used a little bit better. But realistically, the problem was in the layering. It almost looks like there is none. It almost looks like it's one powder from the face of the metal all the way out to the end. And that's where the problem really came in, is not understanding. So I could tell you we took those 2 teeth out. I'm sorry for the red gingiva. This picture was taken right after the patient had a cleaning, but you'll notice that I used the same material, PFM. I added a veneer on one of the tooth. I think it was either the 7 or the 10, I don't remember. And in the end, it worked. So the same space, the same everything, just managing the materials a little bit better was really what mattered there. And again, one of those is a veneer, and 2 of those are PFM ceramic margin crowns. And I hate seeing this case because of the tissue, but that was just after the patient came out for a cleaning. We were able to grab a shot because the patient had disappeared for a while, a long time ago. So most of you know that I kind of work the same way, meaning that everything to me is about the chroma on the cervical, the value in the middle third, and then that effect or that translucency towards the inside. So it's really about the age of the patient. And I do all my buildups the same way. The only thing that changes is what I'm working with from the inside out, meaning if I have 0.6 of a millimeter here and 3 millimeters here, well, then the goal for me is really to build those 3 millimeters out to be in the same plane and have the same optical property to it, and then try to treat it like a veneer. I think that was the best advice I've ever gotten in my life, is think of every case as a veneer case, just get it even first. And that means sometimes you got to be able to build out and get to where you need it to be, and then think of it as a simple veneer case. It makes life a lot simpler. So I manage that same way all the time, chroma, value, and age. And all my buildups are pretty much always the same. And I think even if I'm building an older looking tooth or a younger looking tooth, I'm still building it very similar. And it's the same materials, I'm just utilizing them a little bit different. So as an example, this is the same buildup that I did here, except I'm using more opacious materials inside. I'm using more, I'm going to say chunkier, but density is probably the right word. I'm using more materials that have more density to them, meaning that they have a little more opacity to them. Maybe I'm not cutting them or mixing them much. Maybe I'm even firing them a few degrees lower, just to get a little bit more of a thickness or chunkiness out of them. Whereas in this case, I'm doing the opposite. I'm building my opacity way inside, trying to keep my brightness up as much as I can, and then utilizing much more translucencies on the outside, so I can get more of a light transmission into the tooth. So I know it sounds funny to say it that way, but that's really just about managing those materials. They're very similar buildups. I'm just changing them optically for you to see them differently, or for the light to penetrate through them a little bit differently. So I kind of treat that the same across the board. What do I want the light to do? Do I want the light to go inside the tooth, or do I want the light to come from the surface back out and reflect from the tooth? And I'm managing that really through my material choices, opacity or translucency. And to be honest with you, the cheat sometimes is firing temperature. Sometimes I can finish a case if I want a little bit more translucency on it. Maybe I'm going to take an ENL enamel or my whiter enamel and mix in a very small amount of a glaze powder or a low fusing powder to it. This way, when I fire it, that's actually going to become a little bit more translucency to it, but yet still have that whitish type effect that I'm looking for. And vice versa, if I'm looking for a more opaque enamel on my surface, maybe I want to not overfire it. Maybe I want to just fire it on a second bake or a third bake, or a glaze with a vacuum where I'm really dropping that temperature an extra 5–10 degrees to change the surface of the material a little bit. But that's more outside. Inside, it's always the same for me. It's always about fluorescence. And the fluorescence is either going to be liners, margin, or other materials like stains that you can utilize inside. And I've showed this in other lectures. I think for me, this is kind of the king or the key of everything today in ceramics. I've gone backwards in the ceramic world in the sense that as much as I'm doing less layering on some cases, meaning that we're micro layering a lot more things and we're utilizing our zirconias and our milled materials so much better than ever before, I still want optics. And to get that, I still want ceramic margin materials or fluorescent materials. So even though I'm going to micro layer this, I'm going to still want to get that light into the gingival area of my tooth. And that's all going to be done through, again, margin materials, liner materials, or opacious materials mixed with fluorescent stains. But simpler, use margins, use liners. It kind of works easy for you. So I'm going to say this is an under-designed micro layer case. And I kind of did that on purpose because, especially in the larger labs when I'm working in them, that's the number one excuse I get, right? As well, our milling department or our design department, they don't understand how to create the zirconia the way I want it to be. Okay, that's an excuse. Teach them or figure out a better way to do it. And for me, the simple answer was, I'll do it. Don't worry. We're all doing wash bakes. We're all putting liner materials or over firing our dentin materials on our first layer of zirconia. Well, don't. Why don't you go straight to a liner or a margin material already high fluorescence and treat it like a buildup powder? And then when I do that, I have the ability to actually get more of the space filled with a better material. So that when I fire that, now look at what I'm getting. The value where I want it, the heights of contour, the bluish colors around the insides of the edges, and the chromas around the cervical. And I'm getting all that in my wash bake. And that makes my second bake easy. And I do that with almost every case I do today. It's kind of the standard for me across the board. So for me, when I start to build my ceramic, this is what my case looks like. And by the way, I don't care if it's zirconia, metal, lithium disilicate. I want to start here all the time. I want to start with the right coloration or the right foundation to work through the final case with. And that right foundation is really about, again, the same things. Chroma, value, age. What am I looking to produce on those teeth? So it kind of becomes very repetitious for me. And then my micro layer becomes much simpler. I don't need a ton of dentins. I don't need a ton of mammillon materials. I don't need a ton of translucencies. I already have it there. It's already underneath for me, and I can manage it. So I'll leave you with kind of one case. And this was a case that I used as a course model for the last few years. I think I probably will still use it again here and there, but it was kind of the ultimate for what Jim called the mixed bag. And the reason I say that is because I designed it that way on purpose, where I'm going to do 3 units with 3 different types of materials. And this is what I've been kind of doing for hands-on courses pre-pandemic. Obviously, I like to use a tissue cast. Tissue cast kind of gives me the right emergence profiles. We're going to design this and use zirconia for it. And I'm going to do what I did before. I'm going to do a full contour central, where I can actually layer 1.2 to 1.5. I'm going to do a micro layered lateral, meaning it's going to be 80% monolithic with 4, 5, 6 tenths of a millimeter of layered ceramic on it. And then I'm going to do either a monolithic or a window veneer on the cuspid. And for the courses, I've usually done both. So it's kind of been a way to show how we can get a monolithic to match next to a micro layer, next to a fully layer. And that was kind of the gist of what Jim talked about. And how did I do that? Well, exactly the way we just talked about it before. I'm going to utilize my fluorescent type materials, either liners or margins. I might increase the chroma or value in them with stains. So if I need to, like on the central to the lateral, I have tons of room. I could use more of the liner material and get what I need, where here I don't have the same space. So I'm going to dive into my box of tricks and pull out a chroma stain or a value stain that's going to help to give me a little bit more. When I say value stain, I mean something whiter and brighter with more fluorescence. It's going to help push the light back a little bit more. And then if I fire that, you'll notice the difference right away. Look at how much more intense the chroma is as compared to using just a straight effect liner 3 or something, where I got enough warmth there, but here I really needed to push the warmth. Also notice the blue. I added a little bit of blue stain into either an EL1 or an EL2. Why? Because I don't have the ability to create translucency there. I have a wall of zirconia or a wall of metal or a wall of lithium silicate, whatever it may be, that's going to be optically different than nothing, than air. So I need to kind of fool that optical presence. And then after that, it becomes simple again, right? I'm not going to use 1 dentin. I'm probably going to use 2 or 3. I'm going to use a chroma dentin, a value dentin, and then maybe a basic slightly lower value than whatever I had in the middle third for my transition. You'll notice on this particular case, I actually have a monolithic, so I'm staining that as I'm kind of going along here. So I'm managing similar, but I do this with a window veneer too sometimes. I actually like the window veneer better because I feel like it's really utilizing materials from 1.5 millimeters down to 5, 6 tenths down to 2 tenths of a millimeter. That kind of gives you the best example of it. Finalize my mammillon materials and my buildup. And again, it's all about optics and light. So even look at the monolithic material. You see how I'm getting a little bit of translucency here? as compared to, I'm getting lots of translucency here, but notice the difference between the micro layered and the fully layered. Optically, they're looking very similar. And the only reason they're looking similar is because I utilize some of the staining materials inside to take that space up or optically pull the path of light for me. And then at the end, I'll finish that with a little bit of an enamel. So I think I wound up going back to the veneer version here. And this is actually going to be a window veneer. I'm just basically using enamel on that at this point. I had both. So yeah, this was the window veneer version. And there's my final 3 restorations, right? Again, just a course model. So it's a little bit of a cheat, but I think you could see that I'm getting very similar effects just by utilizing the internal aspects of the material. And I love this. This is a I get bored, so I always want to change my models around, but I actually like this model because it's the best of both worlds, right? Fully covered restoration, 1.2 to 1.5, micro layered, mostly monolithic, very little layering, 0.3, 4, 5, 6, depending on how much space I had, and a window veneer on an unprepped tooth, 0.2, 0.3 if you're lucky. So in the end, my goal was to make all 3 of those blend together and work. But I think really that's the only way to make it work today. So Jim, I hope I was able to hit your topic well. This was a little bit of a challenge one because there's a lot of details in there to explain, but I hope I answered your mixed bag question satisfactory for you.
That was excellent. Yes, you did. I think you hit on real life situations that we all encounter. And I think that's the most important, is how to deal with those different levels, prep, heights, different materials, what does dentist wants versus what's really needed, things of that nature. So so thanks again, Peter. I appreciate it. Those of you that are attending, throw in any questions you have, and we will start to add those questions in. I do have a couple questions, Peter, but at first what I'm going to do is go ahead and show my screen, if you don't mind, and I'll go over a few more things. All right, so let's see, let's back this off. All right, so what we're going to do is, make sure that if you're looking for CE, it will be emailed to you. So, just the information to make sure that we have your contact information as well as your CDT number correct when you registered. The workshop has been recorded, so you can go back and revisit Peter anytime you want and review this webinar and pick up on some of the things that maybe you thought you heard, maybe missed. And then, of course,
I ran through really quickly.
Yeah. Well, no, that's okay. We only have a certain amount of time, so and it just adds to more mystique to bring them to the recorded webinar or to visit you on your next webinar as well. So we will post all of these webinars on our VITA North America YouTube site, so please visit us there. You can also find the links to them through LinkedIn, Instagram, Facebook. If you want to get a hold of anyone here at the office, VITA North America, you can certainly contact us. You can email us at help@VITANorthAmerica.com. If you need to get a hold of your local rep, certainly we have local reps that you can get in touch with and have them visit you and see what we can do to help you and your business as well. We also hope that you visit us again for another webinar. Peter has several webinars for the rest of the year, but we have all sorts of different topics, different subject matters throughout the year. The remaining Peter Peasy's programs for this year, we have on October 19th, we have November 2nd, we have December 2nd, and if Peter's willing to, we can always add more in, different subject matter. Totally up to his work schedule, so please join us any of these webinars so that we can help you out with different subject matter. And then Peter, of course, his information is here. He showed it on his screen. This is pretty much his information. Peter's gracious enough to let you guys contact him if need be, ask him follow-up questions. There's his business phone and his email that you can get a hold of him and ask away, follow up, watch the recording. Any questions you might have from then, give him a call, give him an email, and he'll be happy to answer your questions. So we're going to start with some questions here. So let's start with this question. How long can you extend the porcelain without using the framework to take up the space? So you had shown some cases there.
I can do it as long as I want.
Okay.
I can do it as long as I want is the answer. I think it's funny because the right answer to that question is we're so conditioned as technicians these last five years especially of thinking that the harder the material, the better it is for us. And I would argue that's really not true at all, right? So I get it. In a functional environment, would I want to put feldspathic porcelain 8 millimeters long sticking out onto a class 3 bite? No, of course I wouldn't. It's kind of silly. At the same time, your teeth are there and your teeth have been there the whole time. So in truth, can we extend it from a color and optic point of view? Of course we can. From a functional point of view, should we? Maybe not always, but I would probably push the boundaries way more than most of us think that I need to have this, 8 billion megapascal length first, and then it'll be okay, because that's not always the case. But I want to say that with a grain of salt of, it doesn't mean I want to extend ceramic everywhere across the board without considering bite.
Yeah, I was going to say, I mean, part of that has to reflect on the occlusal scheme, the interference, trying to avoid any contact interference of specific individual teeth that you just built up. I mean, you got to protect them the longer you extend them. So I would imagine. Another question is, so to manage through the refraction using fluorescent materials, do you build up 50 to 60% of the shape and then layer the remaining layering material? Do you have a guideline when you try to build up your internal fluorescent?
Yeah, so it does depend on the space that you have, and I think the reason I like the case I showed at the end of the course model that I was using is because remember one I had 1.5 millimeters of space and one I had 0.6 of a millimeter of space, and in truth I want fluorescent on both of those, but I don't have the same amount of space to do that. So how did I change that? Well, on one, the central, I used straight liner materials which already had fluorescence to them. And I built them out to be a point where they're very similar in the amount of space that I'm going to have on the adjacent tooth. So I'm trying to, the reason I'm not giving you a specific number is because it really depends on what I'm trying to get to. So here's the best example I can give. I need to do a full coverage central, and I have a lateral that's a veneer. In the end, my goal is to bring the central to the same position that I have on the lateral optically. That means that when I use materials on the lateral, I got to use them very thin and still create the fluorescence. And that's why adding a stain to it or something to my liner would give me more quickly and in a small space. But then I have the freedom to bring this to the same position, which in essence should give me a very similar optic ability, reflection-wise or light absorption-wise. So I don't mean to give a wishy-washy answer, but it's not a simple, I do 30%, 50%. No, I fill the space as accordingly needed, especially if I'm trying to get the position of the tooth similar to the adjacent tooth.
So kind of a follow-up, I'm just asking it myself, is in your scenario where you have the different positions and one's behind the other, do you look at, if the color is good for the veneer, then you have to target your prep, the one that's back, to bring it up with the same color.
Yes.
But if you have to change the shade, neither one are a good shade, you have to change them. Do you lean towards one to match more than the other? I mean, which do you try to match
so
better,
in the
the
scenario
veneer?
you're creating, if the veneer, let's say we have 0.5 of a millimeter for a veneer, the chances of me truly changing the shade of that veneer is almost impossible, right? Because there's a certain thickness that we need in general. So
Right.
that's a negative. But let's pretend, okay, we have 6, 7 tenths, and I just want to go one shade above. Well, then the goal would be to get that one shade. I would utilize the color that I have on the veneer and bring the restoration to a similar color, or I would anticipate that I'm going to try to brighten the veneer a little bit and then get even a brighter bring up on the restoration next to it. So in the end, I think the best phrase that I said before is you want to be able to treat every case like a veneer case, even if it's full coverage. So that means get everything to an even optical point of view, and then just say, do I need whiter, brighter enamels, or more translucent enamels, or transition dentins that give me the optics that I want? But first get the playing field set.
Excellent. Okay, that's great. Appreciate that, because I think it really is indication what you have. What do you have to do to try to create that equal canvas between two or more units sitting together, that mixed bag type of thing. You showed a case that you stained or used stains, and the question is, did you mix the stain in with the porcelain, or did you just brush it on top of the surface?
I mix the stains in with the porcelain all the time.
Okay, good. All right. And then when you select the color and it's not exact, do you select the bright? So I think this is the question: is when you're selecting the shade, and as you mentioned, your tabs aren't exact. They're not exact. They're close to. They're references. If you don't find an exact, what do you do? How do you then proceed and correctly choose the right shade tab? Do you go a little bit brighter of the shade tab? Do you put one that's brighter, one darker, in between in the picture?
I got your point. So let's understand that what are we picking when we pick shade tabs? Most of the time, we're either picking value or chroma, right? Those are the two things that you tend to see and you ask relationships for. So if I'm looking for a value and I can't find it, usually that happens more in the lower value teeth than it does in the higher value teeth. But if I'm looking for a value, then I just want a guide that's going to give me a similar value. So let's say the tooth that you're looking at looks like 835, yet it has a very bright or white coloring to it that kind of maybe the patient bleached or something. Well, my value guide is going to be the first pick. And by the way, if you understand the 3D linear system, it's kind of really the way it works, right? Is we pick our value first. And once we understand what the value is, then the next question becomes, okay, I know I'm in this value world. Now am I looking at more chroma or less chroma, and which chroma is it, more in the yellow family or the red family? So I kind of always work the same way. And even before the linear guide came out, I think I treated the classic guide similar, even though it wasn't designed that way. What is the value that I'm trying to figure out what it is? And then the next step is what's the chroma there? And that chroma, just so everybody knows, to be clear, usually tends to shift red or shift yellow. Those are kind of the two main concepts in chroma. When you shift red, the value appears lower, hence C and D shades, by the way, which I don't believe in. And when it shifts yellow, it really means more opacity or more light reflection. And that's really the way I kind of break shade down.
Oh, that's interesting. Yeah, that's a good tip. So we have another question. What base shade do you use for zirconia substructures? For example, do you go lighter in value and use 0M1 for 1M1? Also, which zirconia is your go-to substructure? I think the shade for micro and full coverage buildups. What translucency maybe? So it's multiple questions.
I'm pretty much using the ST, the VITA's ST material for almost all my zirconia these days. I try others and I experiment to see, but that's kind of my go-to across the board. And I've also simplified my zirconia picking, very similar to how I pick dentins in color with ceramics. And what I mean by that is I don't believe there are 9,000 shades. I believe there are 2 or 3 basic shades. I believe that I probably use the same 5 dentins for every case I do, no matter if it's OM1 or A4, right? I'm probably using the same 5 dentins over and over again, just shifting value. So I did the same thing when it came to selecting either my zirconias or my lithium silicate materials. I'm either going with a very bright white core and using pure white, or I'm going A1 or A2 in my substructure. And those are really about the only 3 that I use, is very either white or A1 or A2.
And then build it out from there. Yeah, that makes sense.
Yeah.
Yeah.
I'm sure
another
you're probably familiar years ago, I think Klaus Mutites used to teach the system of seasons, he used to call it. And he kind of broke it down into the sense that there were 4 real shades in life that we kind of had to deal with. And if you understood those 4, you were okay. And I think when I learned it, 15 years ago, it kind of got etched in my head. And I still believe it today that give me 4 substructure colors, 4 good dentins. I said 5 before, but 4 of each, you can kind of do almost anything with if you really understand value and light optics.
There is a question. You kind of suggested a person there. Do you have any recommendations for study materials or courses regarding morphology?
That's hard to do. I mean, look, there's a lot of great books out there. I think that my favorite book was always the Carioca book. I think it was called Analysis. Carioca. I don't know if it's still available. I know people have said they struggle to get it, but that's always been my favorite book. If you can get that book, Carioca. I think it's Analysis. No, it's not Analysis. It's damn. Email me if I'll remember the title. It's a white and green book done by Mr. Carioca, which was fabulous on form and nature and morphology. To me, that's the best one. The other thing, I think, is courses, really, today. And I know those are getting harder to do and come to, but for me, I still think hands-on, sitting with people and kind of doing those things is really the key. So it's funny for me because I think a lot of times people hire me to do ceramic courses, and then we wind up spending a day on shape and morphology and not about ceramics, right? But realistically, that's kind of where it should be. I think that's where you get the best for understanding.
Yeah, there's very little training on that today versus just the basics, especially as we get into digital. A lot of digital technicians are not understanding fully about morphology, framework design, support, and things like that you kind of covered as well.
It's hard because, like I think I mentioned, and I showed that case before, right? That's that London. I'm usually in London once or twice a year for a big course. And that particular last one I did before pandemic was a 3-day course, white and pink, and I showed the case today that as I was doing it. But what's interesting to me is during the 3 days, I think I did that build up in one bake, and then I glazed and finished it with a little correction bake. My point is, we spent 3 days going through shape, form, color, understanding, and I barely had time to build the case at the end. And I remember like it was the last day after 3 days of being there, like rushing the build up because we still hadn't built anything, right? So, and I think for me, a lot of my courses go that way. Fortunately or unfortunately, I always kind of tell people if you come to my courses and you're planning on going home with a beautiful crown to show your friends, you came to the wrong course, because you're going to go home with a lot of things to think about more than look how pretty crown I did when I was there.
Yeah, the knowledge base, I think it has to go alongside the actual practical, functional, driven dentistry. So last question. Do you ever color the inside of your copings, zirconia copings, or any other coping, to alter the opacity, translucency, or do you direct the dentist to use a specific color glue, cement?
So the simple answer is no. One, how would you, right? In the sense of, would you space it more in your design and then try to fill it in? It seems goofy to me. I think I would rather control it through the value of the coping and my layering afterwards, or not use that material, right? If the problem was that you had a black sunshade and you were really looking to mask it, metal ceramic is an answer, where I can make a 0.2 of a millimeter shell, mask it 100%, and then build out what I want. The second part of that question is, my goal with any restoration is I don't want to say trained, it's a bad word, but our system with our doctors is that their job is to use transparent cements all the time. I don't want a colored cement. I don't want any influence from cements. Why? Because I'm using translucent materials. I'm using ceramic margin materials. I'm trying to get optics. So I don't ever really want my doctors to use colored or opacified cements unless we have no choice. Then we got no choice. But in general, our system with all our doctors is such that we're always translucent cements, and it's my job to control the color.
All right. Yeah, you do all that work. You don't want to alter it by the last minute when it's cemented. So, Peter, thank you very much. I think it was, again, a great presentation, a lot of depth to it that actually explains true real case analysis and what to do, how to handle things of this mixed bag. I appreciate you spending the time with us again today. We look forward for your next one, next webinar soon. Any last comments you want to make to the audience before we leave?
No, thank you. I'm looking forward to seeing more people. I know I have some dates coming up. I just finished a few, and I was in New Orleans and Washington, and I think I'll be in North Carolina soon. I think I'll be in Canada finally, so I'm excited about that. And if you're in Arizona, I think I'll be. So I have a bunch of dates coming up that I'm looking forward to. And if there's any place you guys want to organize a hands-on program or something, just reach out to me or Jim or somebody, and we'll try to get something in before it's too late. I know the schedule's been filling up quickly for the last month or two.
Yes, and we're getting to the end of the year too, as well.
Yeah,
we're getting close. Went by fast.
But thank you, Jim. I appreciate the challenging topic. So thank you.
Well, we'll keep at it. We'll drill through all of the exciting real life cases that I think everyone has a question about. They just are hesitant maybe to ask the question and how to do something new. So I appreciate you stretching your education to these topics.
No problem. I'm going to dive back into work. I got a case waiting for me to finish. So,
all right.
Into work. Thank you, though, for everything, and I appreciate everybody coming and spending time with us every time I'm on. So thank you.
Yeah, thank you, Peter. Thank you, the audience. If you have a time to visit our website, you can watch the recording again of today's presentation with Mr. Peter Peasy. Otherwise, this will conclude today's VITA learning webinar. Have a good day wherever you may be. Thanks for joining us.